Uh, I hope this will be a very fruitful 1 hour session for all of you. I wholeheartedly welcome Rajmohan sir for the talk. Thank you, welcome sir.
Thank you so much, sir. Thank you. Thank you for the nice words. Thank you. So I shall now share my screen. So I have developed this paper by discussing with many experts in the field. I have discussed with the pharmaceutical experts of Toronto Pharmacy College and a couple of pediatricians who are engaged in pediatric, research in this particular area. And of course, many of Ayurvedic pediatricians who are doing, pediatric practices and their difficulties and all I have included in this paper. So this is a very lengthy paper. Why I choose this paper, I don't know, because Ramesh sir was spontaneously calling me to tell a topic. So this subject I was just playing with my PG student. So I suddenly this came to my mind. So it's a very lengthy paper. So my presentation would be of around 45 to 45 minutes, and the rest 15 minutes we will have a discussion. So I won't skip any slides in between. I will take the entire thing as continuously, and up to what extent we can discuss in 45 minutes, I will just do it. And that itself will give you some information regarding the initial aspects of what are things you have to keep in mind while you are designing a dosage form. As far as your dosage of and my persons, even though it is just like a pediatric, we are discussing in terms of the pediatric population, there are guidelines, or these will give you an overall idea what are the factors you need to consider while you are designing a dosage form. So some of the theoretical aspects that we need to consider regarding pediatric practice in Ayurveda. Separate branch termed as Kaumara Pritya deals with the human life far beyond conception until maturity. You know all these things. But, since I am a PG student, I was a PG student, I have included all the things. But there is a very specific thing we need to keep in our mind, because this Kaumara Pritya branch is very unique. It is not as equivalent to the pediatric practice, because even in the Ashtanga, when we take Ashtanga, this Bala Chikitsa actually covers Prasuti Sri Roga as well, because there are chapters, there is no separate branch for Prasuti and Sri Roga as far as Ashtanga is concerned. So it's a branch for Kaumara Pritya far beyond conception and until maturity of the baby. So there is a large covering of aspects, many aspects covered in the Kaumara Pritya, because for a successful survival of a child, basically that should start far beyond conception. So that is the concept of Kaumara Pritya. And we have all classical textbooks explain that. Even pediatric practices are very robust in Kerala. There are several biological Vaidyas were available, and Arya Kalpadruman like textbooks are available. So plenty of formulations are available. Particularly, I have to talk about Arya Kalpadruma, in which you have several leading formulations that are made out of the local flora and fauna, as well as utilizing Kera Taila. So the use of Kera Taila is very prominent and evident in Arya Kalpadruma as well. So that kind of thing. So Kerala is definitely the Kerala Kaumara practice is naturally the robust one across India when you consider such practices across India. But even though at our times, while I was doing my PG and post-graduation and BAMS, when we look into the pediatric practices, now it is not like that, because we have Ayurveda was successfully infiltrated into many aspects of practice in Kerala. I don't know the status much in other parts of the country, but of course in Kerala, pediatric practices nowadays are as equivalent as other systems. But in our time, pediatric practices are much more effective in homeopathy. So homeopathy was there. First it comes the modern system is there. Then comes homeopathy. Then the third position was mainly done by at that time. But now I could say that much more it is Ayurveda practices are much more infiltrated than homeopathy practice in public health. Most drugs are used traditionally without consulting a doctor. That is another issue generally Ayurveda is facing, because there are many Ayurvedic formulations in pediatric practice, but majority of them are not prescribed by a doctor. There are these conceptual preconceptive prasuti care is there. All those Garpini Charya and Prasuti care and all those, that people also suggest some medicines for the common medicines for the pediatric size. So basically, when it comes to a physician view, why these pediatric practices are not that much popularizing. The issue is that some of the issues are issues should be dealt with the Rasashastra Pachithinapna persons. So basically, there is a lack of acceptance of the system as a whole. Now it is slowly increasing that acceptance. We have an issue with the acceptance, absence of proper guidelines. Whenever we are about to practice, why you are not prescribing Dasa medicines to an infant? Naturally, the question comes in a general practitioner that I don't have a proper guideline over that. How many of general practitioners are specifically prescribing Dasaushadis or some of the potent Bhaishajya formulations to children? Only a few are prescribing that because of the fear of complications, and as well as specific diagnostic techniques probably are not available. And the neonatology practices in Ayurveda are not that much robust. Again, the acute conditions, failure to handle acute conditions, complications, and possibility of ignorance of possibilities. There are so much of possibilities exist in Ayurvedic practice, particularly in Kaumaraputya region. Now we are having specialized centers in Trivandrum Government Ayurvedic College, this ADSD and autism-like conditions and developmental disorders are. Now there are a lot of patients coming from various parts of the country to treat those conditions in Trivandrum. So we have a possibility and all those things in general Ayurveda practices, but proper dosage forms are not available. While you're designing dosage forms or modifying dosage forms, there are several factors we have to keep in your mind. That all comes under pharmaceutical view. Accurate dosage forms which can be utilized in a pediatric, typical pediatric formulations. Pediatric formulations always have certain specifications. But those kinds of formulations probably not that much available in Ayurveda. Stability is one of the issues, as well as non-sterile nature of the dosage forms. Stability and sterility are two components which are every pharmaceutical dosage forms or every food preparations or nutraceuticals or cosmeceuticals need to have. Unfortunately, majority of our formulations, it's very difficult for us to keep it stable as well as sterile. So that is one of the reasons. And again, palatability is coming to an issue with the majority of our formulations. When it comes to the patient's view, basically, whenever you are prescribing a kashaya, you are telling the patients either to purchase the raw drugs from the market, and you tell them to have 50 grams of that, add eight glass of water, boil it and reduce to 1 glass. So it's a tedious process for them. Even if it is Sushma Churna, the patient has to prepare it separately. Even if it is the kashayam extract, the patient has to boil the water, mix it with that, or the kashayam tablets. As far as a physician is concerned, it is not that much. The efficacy of that is always questionable. And the dose is also a thing. That is one of the user friendliness is not there as far as the patient view. Next comes the bulk of the medicine. Always a pharmaceutical product, the bulk should be reduced. So that means should be able to do its proper activity for its potency, show its potency in a minimum dose as far as possible in a minimum dose. So that is alpamatra upayogita, the Arijera percent. We all know that sloga. Again, difficulty in storage and application. The shelf life of Ayurvedic formulations, particularly in the Panchavida Kashaya Kalpana, are very less. So you need to modify it whenever you are modifying stabilities in threat. And the palatability also is one of the major issues as far as patients are concerned. So these are the general aspects that you need to keep in your mind. These are some of the issues with the Ayurvedic medicines as a whole. These industries, there are over 800 or 700 very active industries in Kerala itself, and they are all working with the same issues. They are all having the same issues, and unfortunately, our academia across R&B academy across the state are not addressing these kinds of issues. And there should be some provisions so that the industry and the academy should sit together and to design research that can be in future can contribute to the industrial aspects as well. So whenever it comes to the children, children not always can be taken as a mini adult. There are several aspects we need to consider about the children. When we are administering a medicine to a children, many factors are need to be discussed here. For example, anatomical and when it comes to anatomical and physiological aspects, absence of coordinated oral and pharyngeal movements in the early life. This is one of the major issues whenever you are giving a medicine to a child. Particularly in neonate up to 6 months, even up to 4 to 6 months, the movement of the tongue is upwards and outwards. You just try it in your mouth. The movement is upwards and outwards. What is your tongue movements? It is upwards and inwards. So upwards and inward movement means you will be able to swallow things. So upwards and outward movements, what is the role for that? You think about it, because it is to express the milk. So milk expression is possible with the upward and outward movement. So that is the typical tongue movement of a neonate, particularly up to 4 months, you can say. And that is the pattern of tongue movement. And there is no coordinated oral and pharyngeal movement. The problem here is that you cannot give a solid directly to a neonate. So you should be very careful. Even if you are mixing it with some honey or mixing it with some Dravadravya, it is not possible to administer a neonate, particularly, or up to Pakshadida, up to 4 months or so. It's very tough so they cannot swallow it properly. Why? Because there is no coordinated oropharyngeal movement. So that's why there are certain anatomical and physiological factors that you need to consider. Again, many parents are complaining that, how can I give a kashaya to a neonate or a kashaya to a baby up to 6 months of age, or 1 year or 6 years or so. So because it's very kashaya rasa, or it is very thick rasa. Surprisingly, babies, particularly infants up to 4 to 6 months, it will take at least 8 months so that the all tastes are perceivable by the baby. It is only sweet and salt taste initially perceivable by an infant. So you can either give kashaya by adding a sweet, so that only that sweet taste will be perceived by the baby, or you can add it with the salt, so that the salt will be perceived by the body. So they like these two tastes, and so that they won't be able to taste the pitta rasa or kashaya rasa or any other rasa. Of course, hot always you should be very kadapasa. Always you should kadapasa is not considered as a taste. It is only a sensation. Why? Because you can perceive that hot feeling everywhere in your body. It's not only from the tongue. So preference to sweet and salt. You should be very careful whenever you are adding sweet to a baby. The sweetness should not be more than the taste of the breast milk. If you are going to add more and more sweet to a baby, the threshold of sweet in a baby would be elevated. So the later in life, they may use more and more sugar and more salt. So that is the thing. So you can administer, the sweet and salt is the two taste, an infant in his early life will be perceivable. Interest in solid will be start from 4 months onwards. That means that solid 4 months means then only there will be coordinated oropharyngeal movements. So churnas or kalkas or whatever it may be, you are administering to a baby gudigas directly to a baby. It is only possible with after 4 months. Otherwise, if you are giving something in the mouth, that will remain in the mouth. That is the thing. The baby will not swallow it. The next thing is that reduced renal function and reduced hepatic activity. These two things are and underdeveloped metabolic pathways. The babies does not have, particularly neonate, will not have any bile. The bile activity is just developing. And what is the importance of bile in our body? Because bile is emulsifying fat, and fat is necessary for the growth of a baby. Enormous amount of fat will be consumed because the cell structures, the plasma membrane, everything is developed out of fat. So naturally, there are a lot of fat is necessary, but unfortunately, bile is not there. So how will a baby can cope up with that? Then the nature is having an idea that the nature is actually giving pre-emulsified fat. Milk is nothing but a pre-emulsified fat which will be easily absorbed by the baby. If you are giving a fat directly, the baby cannot absorb. So think about the administration of krita preparations, lot of krita preparations early life in early infancy, because the child will have difficulty in digesting and assimilating krita preparations under 4 months of age. So always keep that in mind. And again, another issue is that the baby is developing the hepatic system. The liver is under development, the kidney is under development. And what is the importance of significance of liver? The liver is having the cytochrome P450 pathways through which xenobiotics and all drugs are metabolized and produced into metabolites. So the problem here is that the metabolic pathways are actually developing. So majority of the drugs or toxic substances that reaches a substance that reach an infant's body, they cannot actually metabolite into its metabolites. A poison may be active only when it is metabolized in the liver and formed a poisonous substrate. So in an infant with poor hepatic activity, if a poison is reaching there, most often this will not be metabolized. So if it is not metabolizing naturally, that will be kept in the liver. So mostly a baby will have a toxicity arising from a poison or a medicine or anything he is consuming, not because that it is the poisonous activity will not be there. Instead, there will be hepatic failure will be there, or hepatic issues will surfacing. And again, the same activity is there in kidney because the poor renal activity is there. So all those drugs which are excreting through the kidney, you should be very careful, because the renal activity is poor in particularly below 4 months of age. So these are the things. So whenever we are giving, that's why if we are giving a Rasaushadhi, if you are giving a Rasaushadhi, you can specifically know that the Rasaushadhi is actually taking this hepatic pathway, and that should be properly metabolized in the liver. So this metabolism may not be there in a baby, and administration of Rasaushadhis below 4 months of age or something can have erratic behavior of that medicine. So I have talked with many practitioners of Kaumari Prati at that time, very senior practitioners, and I asked them whether you usually give Rasaushadhis to these kinds of under 6 months of age, and many of them told me that no, they usually don't do that. But even if they found that there is an erratic result. Some babies may respond to that positively, and some babies will not have any effect, something like that. So that is justified by these kinds of things. It is very thing. So again, immature enzyme systems in the neonate. In neonate always have immature enzyme systems. That's why we are not giving all kinds of food. If a baby can digest all kinds of food, probably he can manage all kinds of chemicals around him. And again, reduced immune response in the GI tract. So as far as possible, whatever you are administering in a baby should be very sterile. So think about you are giving Swarasa Kalpana. Be very careful, Swarasa and Kalka Kalpana, because both of those things, and of course Churna Kalpana, these things are very very not that much sterile preparations. So we have to make it much more sterile prior to administering in a neonate, initially in the beginning months. Reduced gastric acid secretion, so the digestion will be very poor. Reduced biliary activity, so the fat absorption will be poor. These are the initial parameters. So you just go through that. That means what are the things we need to consider while administering medicine designing or administering in a baby, because there is no reduced oropharyngeal coordination. Then comes the liver is actually developing, and the metabolic systems are actually developing. The renal function is low, hepatic function is low, bile, there may be total absence of bile. So the GI tract immune system is less responding, and all those things. Then comes the physiological parameters affecting oral drug absorption. You can see the parameter. Neonate, the gastric acid secretion is reduced in neonate. In infant, it is normal, and a child, it is normal when compared to an adult. As that of adult. Normal means as that of adult. I'll just click a highlight. Sorry. This is as that of an adult. So gastric acid secretion is reduced, means whenever you give a drug, if the gastric acid secretion is reduced, means that the deterioration of drug is prevented. If more is the gastric acid secretion, more will be the deterioration of the drug. So in a neonate, the deterioration of the drug is somehow reduced because of the reduced gastric secretion. But in infant, it is normal as that of adult. In a child, it is normal as that of adult. But gastric emptying time is decreased. Even though the gastric acid secretion is less, gastric emptying time is decreased. Gastric emptying time decreased means whatever drug you are administering, that will reside in the stomach for a long time. Residing in the stomach for a long time means that is exposing to the acidic pH for a long time. That will deteriorate the drug. So when combining these two things, it will be normalized. Even if it reduces the secretion, the increased exposure to gastric acids the deterioration will be balanced. But when it comes to intestinal motility, there is a reduced intestinal motility you can see in neonate, and gastric emptying time actually increased in infant. So intestinal motility is reduced. Intestinal motility reduced means there will be more absorption. More is if the intestinal motility is very fast, as in the case of diarrhea, what will happen? There will not be much absorption or reabsorption of the nutrients, and if a diarrhea is continuing, that person will be in a lethargy or will be tired or in a weakness very very fast. So we need a reduced intestinal motility means prolonged exposure and better absorption. So even if the dose is small, the intestinal motility is reduced, there is a provision of absorption because there is the reduced intestinal motility. Biliary function is reduced means that you cannot have key-like preparations. Krita preparations be very low. Those should be standardized or minimal, and large quantity of krita preparations are difficult to digest. Microbial flora is acquiring. If there is no microbial flora, means the cellulose-like things cannot be digested in a baby's in an infant's intestine. So these are the factors. This is for neonate to 2 months from the birth. This is the status of the gastrointestinal tract. Gastric acid secretion is reduced, but gastric emptying time is decreased. Will stay there for a long time. Intestinal motility is reduced, favoring the absorption of the drug. Biliary function is reduced. It is unfavorable for a certain kind of drug activity. And again, microbial flora is acquiring means that herbal material, herbaceous material, there will be difficulty in managing herbaceous material. Then comes infant gastric acid secretion is normal. Gastric emptying time is increased. So that means the deterioration of drug is very low in an infant, because acidic deterioration of the drug is low in infant because the gastric secretion is normal. Gastric emptying time is increased. That means there won't be any prolonged exposure with the acid. But it is normal, and intestinal motility is normal. The deterioration is comparatively lower in an infant and the child. All other parameters are actually in an adult pattern. So they just keep these things in mind. When it comes to toxicological aspects, when we perceive the toxicological aspects, failure to form poison substrate is one of the major issues that happens in an infant, or particularly in neonate. So we have to be much careful while you are administering Valsanabha, while you are administering Langley containing drugs. It may not have a poisonous substrate, and it will not show any poisonous effect in the baby as such. But the failure to detoxify and excrete toxic material, that may create problems in the body. This toxic or detoxification material enzymes may not be active and excrete toxic materials. This may lead to accumulation of toxic material in the liver or accumulation of toxic material in the kidney that can cause failure of organ system. Just like particularly liver cirrhosis is possible with these kinds of things. And again, uncertain effects of heavy metals. It is there in the pharmacology of heavy metals in the textbook itself. Uncertain effects of heavy metals observed in the infant stage because heavy metals cannot form substrates, or heavy metals cannot be metabolized properly. Narrow safe toxic border. The safe toxic border is very important in drug administration. What is a drug is very safe. The safety of the drug is safe at 100 milligram, and it is toxic at 105 milligram. how can you administer that drug? The drug is very effective in 100 milligram, and it will turn toxic in 105 milligram. You just think about that. Will you prefer a drug which is toxic at 105 milligram and effective at 100 milligram, or you prefer a drug which is safe at 100 milligram or effective at 100 milligram and toxic at 1 gram? Toxic at 1 gram, so that if an accidentally if you add another pinch, that will create toxicity in the first drug. So the safe toxic border, larger the safe toxic border, safer will be the drug. Narrow the safe toxic border, it is unsafe to take that drug. So you have to keep in mind that whatever is the drug, the safe toxic border is narrowed in a child, or so you have to administer the exact dose required for that baby. There is the pharmacy college is near to Trivandrum Medical College, and the role of the pharmacy college is that they dispense the medicines. They formulate, they compound and dispense medicine for neonate in certain conditions. They will calculate the dose for antibiotic using certain formula, and they will calculate the surface area, the weight, and all of the baby. Then they will compound the medicine and dispense so that the baby get an accurate dose. Why? Because if the dose is slightly altered, it can produce toxicity, and the dose is less, it cannot produce any therapeutic efficacy as well in a baby. This is very important, that increased cutaneous toxicity. Child has, all the babies, particularly infants, have increased cutaneous toxicity. So you cannot easily administer all oils or all something on the in the baby's skin. The two things are there. One, the permeability of the baby's skin is very high. That is the first thing. Next thing is the cuticle covering is acquiring. So naturally, many things can directly absorb from the skin and can produce toxicity. Particularly, malathion, parathion, all those kinds of organophosphates and organochlorine things are very toxic, basically. And even if that falls in an adult skin, that can be directly absorbed and create toxicity. You think about this happening for a baby, naturally the size of the baby is small, and again the skin is very soft, and also there is no cuticle covering is only acquiring. It can easily be absorbed from the body, and it can create issues. Whenever you are taking pest control measures in your home, make sure that you should not do it in a baby's room, particularly a neonate or infant is there. You are pumping something, and you feel that you may use cockroach hit may be using all those things. The poor lung, the the developing lung of the baby or developing skin of the baby can absorb it in a large volume. So be very careful while you are doing. You should be very careful while you are administering Dasotamavi lepam. You should be very careful while administering Jatyadi Kirdam, because all those contains, Rasaushadis, which can be, that combinations can be absorbed through skin, because that skin barrier in an adult and skin barrier in a baby is totally different. So you need to keep all these things in your mind while you are selecting and prescribing medicines for a baby, and specifically designing a drug for a baby, for a child. So what are the major ideal pediatric dosage from conventional view? ഒരു കുട്ടിക്ക് കൊടുക്കാൻ പറ്റുന്ന ഏറ്റവും നല്ലത് എന്താണ്? കൺവെൻഷണൽ വ്യൂ മീൻസ് ഇൻ ദ മോഡേൺ ഫാർമക്കോളജിക്കലി എന്താണ് which is preferred the best? Oral and liquid dosage forms are preferred most. Which is the ideal route of administration for an infant or a child? It is always the oral. It is not an injection. It is not anything like that. Liquid dosage forms are preferred most. Why liquid dosage forms are preferred? Now because there are the anatomy is something different. The oropharyngeal coordination is something different. So it is always oral and liquid dosage forms are preferred most. Now you have the idea what are the formulations you should give it to a child or infant or a young adult. In a Kshirada or Kshira Annada, it's fine. We will shift to that classification, then that would be much more easier. So in infancy period, oral or liquid dosage forms are always preferred, and should be palatable or sweet or salty taste or with no taste. That is the thing. Maximum sterile. Sterility is the rule for an infant formulation. We call it as sterile preparations. Are two formulations are basically sterile, which are ophthalmic preparations, and injectables are considered to be need to be very sterile. and formulation for a neonate or infant as far as possible should be sterile. Dose should be uniformly distributed for easy administration. If you are suspending something, that should be uniformly distributed. You need to shake well before use. Otherwise, the issue is that initially the baby is getting only the medium, and towards the end, the baby may get a highly concentrated drug portion. So you should be uniform drug administration is always important. Aqueous solution is always preferred. Always preferred is aqueous solution. Aqueous suspensions come next. Soft gelatin capsule, hard gelatin capsule, uncoated tablets, and coated tablets. This is for children. Basically, for neonatal infants, aqueous solutions are more preferred. Encapsulated and tableted medicament should be dissolved in appropriate medium before administration in young children. Swallowing should be sometimes swallowing may be very difficult for young children, and we have to keep that in mind. So even if it is encapsulated, if it is possible, maybe dissolved in appropriate medium for that. What are our views regarding the administration of drugs in Garphini and Bala, Garphini and in babies? We have almost similar thing. Garphini means why Garphini is cared so much, because the fetus is there. Fetus is as equivalent as that of as a young infant. So mrudu means potency should be controlled. Always it should be mrudu, mathuram and surabhi. As far as possible, sweet and good odor for better palatability. The medicine should in a children, administration in a children should be of good odor or must have a better palatability. Then comes, it should be leku. Leku means easy to absorb and assimilate. Samshamana karma. Samshodhana aushadas are not preferred in children. Why? Because samshodhana aushadas are basically vyadhi viparita aushadas. Hedu viparita aushadas and vyadhi viparita aushadas are there. Hedu viparita aushadas are basically that will be there. Hedu viparita aushadas are, we administer Hedu viparita aushadas focusing on the Hedus. When at what stage of the disease we are administering Vyadhi viparita aushadas? When the dosha is seated deep into the dhadus, naturally there is an interaction of the dhadus with the doshas. For that, you have to administer Vyadhi viparita aushadas. Vyadhi viparita aushadas, the problem with the Vyadhi viparita aushadas and Shodhana aushadas, they interact with the dhadus. So, imagine that a baby is growing, the child is growing. So the preliminary thing that always we need to protect is the growth of the baby. If you are giving a dhatu, a drug which is interacting with the dhadus which are growing, probably that may affect the growth and development of the baby. So always you have to keep in mind that samshamana karma is preferred always over samshodhana karma for a baby. And kapha medohara, almost all, majority of the diseases are kapha medohara yoga, which are occurring in a baby. Hedu viparita aushadha should be given instead of Vyadhi viparita aushadha. That we have already explained. We'll leave all those things. Importance of the age is always there. Not always considered as mini adults because of saukumaryata, alpakayata, vividha anna anupasevana. The third one is very important. Vividha anna anupasevanada. Because actually the GI tract of the baby is trained phase-wise. First of all, the mother is training the baby because the mother's colostrum contains several enzymes and several growth hormones that will promote the growth of the GI tract of the baby. So that's why there is up to 6 months or 1 year, the breast milk is the best thing, that the breast milk is facilitating the growth of the GI tract. Now, then what we will do, we will put the baby into Shira Annada. We will expose the baby into food one by one. So whenever we are exposing, naturally, the genetic system of the baby, the genomic system of the baby will be active and identify that food material, and the required enzymes will be produced in the body. So we have to expose the baby stepwise into each of the food. At least you need to introduce one food per week. So you should not introduce 2 or 3 foods together, so that you may not be able to detect if anything goes wrong. You may not be able to detect which food caused the diarrhea or constipation or something like that. So you have to expose the baby into new food 1 week, one food per week. So that will help the baby to, just like to understand what is happening and to develop the enzymes which are necessary to digest that kind of food. So that is the second stage, which is Shira Annada. So that training period is over. We are shifting the baby to Annada, and Annada means almost all kind of food can be taken by the baby, by the child, and he can also take almost all kind of medicines. In Shira Annada means he's not exposed to many of the food materials, so that he cannot also may not be tolerant to many of the medicines as well. Shirada means the administration should be very limited to a small number of medicines, because the baby is also not exposing to too much of chemical constituents or too much of food materials or something like that. Because many of the food material means he is exposing to many of the chemicals as well. So the best classification of children we can observe in, basically it is in Arogyalpa Drumam, Jadamatran, Pakshadidan, Atipakshan, Trimasikan, Shanmasikan, Ekabdan, Tridan, Panchahayanan, Ashtabdan, Dashabdan, Dwadashabdan. These very elaborate classification of children given in Arogyalpa Drumam. This is based on the growth and development of children. You cannot simply administer, you cannot expose the baby into all type of food when he reaches 6 months or 5 or 6 months of age. Why? Because you know that the GI tract is not developed at that time. So that 6 months or Shirada means a functional classification. A Shirada cannot be exposed to all types of food. A Shirada should be shifted to Shira Annada by exposing slowly, as I said, one food per week, just like that. So these kinds of classification indicates the development, growth, and development of children, which is making him capable to digest many types of food. Shirapan means depends only on breast milk. That means a selective type of constituents are welcome in the baby's body. Shira Annada means a little bit more, just like the usual solid food. You are slowly exposing to some of the solid foods, and so the gastrointestinal tract of the baby is learning how to cope up with the external world. But when it comes to Annada, it's purely purely independent of the mother, and he can consume almost all type of food depending upon the thing. And sometimes there may be some gastric irritations here, which is expressed as diarrhea or constipation. Likewise, he may select his food. So we are slowly, the gastrointestinal tract is learning to interact with the external world. So that is the classification. The classification above is very important in the science, determines the type of dosage form and the medicine we have to administer. And again, we have to, when we go through our classical textbooks, there are a lot of things explained there. Bhaishajya explained for children is sapakta, along with food. Why? Because that is the best method to administer giving. Sapaktam means you can process the food along with process the medicine along with the food, or you can mix medicine with the food. In a child with a specific taste, as I told you, for an infant this is not a problem, or a baby up to 6 months this is not a problem, because they can only perceive sweet and salt. But when it comes to the child stage, children of 2 years or 3 years, it is always sapaktam is better. You have to mix indaganta kridam with the food, or you can add some krida in the milk, or you can mix kashaya with plenty of honey, or you can add some kandasita with kashaya. So everything likewise to make it more palatable. Continuous medication in children should be avoided. It's just like try taper the dose rather than giving full dose after the disease has considerably responded for non-recurrence. Always Vyathyavastha Kala is preferred over Kshanadi Kala. Kshanadar Vyathyavastaja Kalo Bhaishajya Yogagrat. Kala is explained specifically for drug administration. Kala is of two types, Kshanadi Kala and Vyathyavastha Kala. Kshanadi Kala means you are expressing the dosage in hours or Kshana or Muhurta, etc. I will give an example. Give paracetamol 6 hourly, or Vitamaran Guliga morning, afternoon, and night. This is actually Kshanadi Kala, because you are not considering the avastha of the disease. Then what is the Vyathyavastha Kala? You administer Vitamaran Guliga only if it is fever, or only if it is jara you administer. You administer paracetamol if there is temperature is there. You administer paracetamol. So that is the Vyatyavastha Kala. Kshanadikala means, without considering the Vyatyavastha, you are simply telling that you take the medicine 6 hourly or daily once or early morning or something like that. Ayurveda, every chapter, every medicine, there are proper guidelines for both Kshanadikala and Vyatyavastha Kala. I'll give an example. Shadaham va, Mriditvam va, Joro Yavadapniya. Shadaham is the Kshanadikalam. Soon they are explaining about Mriditvam or Jwara Mriditvam. Either you administer Kashaya after 6 days. That means if you are not that much an experienced doctor, probably you will have difficulty in determining the Vyatyavastha Kala. If that is the case, you administer what? This Kashaya after 6 days, because majority of the persons under Lenkana, that Jwara Mriditva will appear after 6 days. So that is a Kshanadikalam. But you have to keep in mind that at least a 5% person can develop Jwara Mriditva in within 5 days or 4 days, or some other persons can develop Jwara Mriditva after 8 days or 9 days. So if you are taking the 6 days rule, it may not be applicable for these two things, and there is some kind of difficulties may occur. So it is always better to focus on the Vyatyavastha Kala. So Kshanadikalam is there. So it is there everywhere. When you have to administer Krita after 10 days or Vada Pittotare, Kosta should be Vada Pittotara. So when it comes to Panchakarma as well, you can see the same thing, Kshanadi and Vyatyavastha Kala. Mathyane Kinjidavarte. Mathyane Kinjidavarte is the Kshanadi Kala for administration of Vasti. Then what is the Vyatyavastha Kala? Na adi bubukshida. The patient should not get a hunger. The slight appetite should be there, and it should not, ati bubukshidhatvam should not be there. So this, like Kshanadi Kala and Vyatyavastha Kala, is explained our science. Just like that, you should always focus on Vyatyavastha Kala while you are administering medicine to a child. No need to stick the dose for the age in case of a child. Sometimes we are calculating the calculating dose with using Dilling's rule, that kind of rule. But I would say that it may not be possible for a age, rather than stick to that. A 10-year-old boy should receive this much of medicine. Somehow it may not accurate, because a 10-year boy may have may have obesity, or a 10-year boy may be very thin or underweight or something like that. So rather than simply focusing on the age, the physical structure and the physical size, surface area, all those factors are more important while we are designing and administering a medicine to a baby. Vyatyavastha Kala is more important than Kshanadi Kala, which I already explained. Then it comes to which are the dosage forms that are very important dosage forms which can be administered in children, is known as the water soluble oral dosage forms are very important in children. You think about our kashayas, Sita Kashaya, Fanda Kashayas can be a better thing in a baby. Why? Because oral route for drug administration is preferred whenever possible in a child. As far as possible, you select oral dosage forms. Most convenient, safest, and economical water-soluble drugs, which are distributed mainly in the extracellular fluid, have their larger relative volumes in neonatal period and early infancy, and decreases throughout the childhood. I will just explain that. In a baby, basically the babies are very soft, particularly in infancy. They are very soft to touch. Why they are soft to touch? Because the relative water compartment in a baby's or infant's body is very high. We have more fat, we have more. The relative water compartment in an adult is comparatively less, but the relative water compartment in a baby's body is relatively high. That is very soft to touch. So the water compartment are more means water soluble and aqueous dosage form will have much more distribution over baby's body. That's why pediatric practice, whenever you're managing with some kashayas and all, you will get much more good result than in an adult. This is because the oral medications, particularly water soluble and kashaya, those kinds of formulations can have a much effective distribution in an infant or child body, because of the relative percentage of water is more in a baby. And this peculiarity is there in Ayurveda because mother for drug delivery in neonate is a very beautiful concept. Maybe depending on mother for his nutritional as well as emotional requirements. The breastfeeding means an emotional connection and as well as a nutritional connection. And in Arogya Kalpadruma, in a neonate, particularly Pakshadidan and Adipakshan, 15 days and after that, up to 2 months or 3 months, mother is the drug delivery system for the baby. It is clearly explained in Kashyap Samhita as well. As if the baby is having a problem with the indigestion or something, the mother has to take Ashtachurnam and feed the baby. Why? Because this whatever happening in the mother is transferring into the baby. The mother may have a subtle dosha klesha that may not be able to create a full-fledged disease in the mother, but the same thing can cause, if transferred to the baby, can cause a full-fledged disease. So the mother has to take the medicine, and she should, feed the baby. And Lenkana, if a jara is happening to a neonate or a chirada, the thing is that he is only dependent on the mother. Then how a Lenkana should be done? Whether we can put a baby into Lenkana, it is not possible. So it is explained in Kashmikas that the mother has to undergo Lenkana and feed the baby. So the mother is the drug delivery system for babies. Somatic and psychic disturbance in mother contributes to majority of common ailments in children. That is very important, and there are several papers coming out of that. And since we don't have that much of time, I'm not moving into those kinds of studies. Imbalance in mother system is able to produce a full-fledged disease in children. Nija vikaras of alpa dosha aushada to mother. So this is the rule explained in Kashyapa Samhita. If nija vikaras of alpa dosha, if a baby is getting a nija vikara of alpa dosha, only give aushada to mother for in a chirada, because that vikara that is probably coming from that disease is transferred from the mother. Nija vikaras of prabhuda dosha in chirada and chira annada aushada to both. If it is a dosha is prabhuda, naturally the baby will have a dosha dushti and the dhatu interaction will be there. To remove that, naturally we have to administer Hedu Virida as well as somehow Vyadu Virida also. So you have to give medicine to mother as well as to baby. Agandu Vigaras Aushada to baby and Pathyas to mother. That is also important. If there is a trauma happened, if some insect bite is happened in a baby's body, in an infant, what would you do? You have to administer, it is an Agandu Vigara. You have to apply external applications to thing, and you also need to give medicine to the baby. But Pathya should be taken by the mother, because the nutritional need in a Chirada, actually the milk is coming from the mother. So the Pathya is applicable to mother, and the medicine is applicable to Agamda Vigara, as the medicine is applicable to the infant or baby. Usually Chirada and Chira Annada, the above is followed, but it is particularly important the first 15 days of life. I will just give you I think our time is already over. It is almost 3:30. Soresa, traditionally practiced but not much classically supported. When you go to Soresa application in children, if I have gone through almost all the classical textbook, you cannot say that the classical textbook are supporting giving Soresa to a baby, Soresa to an infant. It is nowhere in our classics. I don't know why we are giving some of this Soresa even in neonate. And in Arogya Kalpadrima, in Pakshadita or Adipaksha, no Soresas is explained. No Soresas are explained. Traditionally practiced but not much classically supported. Guru and mostly used as Vyadhi Viparita. Soresas are very powerful and which are very Vyadhi Viparita as well. Difficult to make the preparation sterile. So sterility is an issue. Controlled use in Chira, Annada, and extensive use in Annada onwards. You can easily give a Soresa to a Chira Annada, but extensive use you can give in Annada, because Annada is fine, because Annada's GI tract is exposed to many types of Soresas as well. But when it comes to Chira Annada, even you should be very careful while you are administering a Soresa. Kalka and Churna, again, Kalka is for Ardhara Dravyas and Shushka Dravyas, and Churna is for Atyanta Shushka Dravyas. Mostly in the application level, churna is also used as kalka form. You know it. Churna is preferred in pediatric use as it can be made sterile much effectively than kalka. Churna we can dry the churna in sunlight because sunlight itself is a cheapest method of sterilization. Controlled use from birth and extensive use from Kshira Annada. Churnas can be, how can you administer churna to a baby? You make it into a kalka and paste it over the nipple of the mother. And then you give, then you feed the baby. The advantage is that that will mix with the milk and it will go inside. If you are going to directly give it to the mouth of the baby, up to 4 months, there is no coordinated movement. The baby cannot swallow it. So always, this is the best route as well as Aragel Pudrima is mentioned. You smear the medicine over the nipple of the mother and feed the baby. Controlled use from birth and extensive use from Kshira Annada. From Kshira Annada, the Churna Kalpana it is appearing in many of the classical textbooks. From Kshira Annada, Churnas are effectively done. Anupana always use a proper Anupana for that. And this is my last slide, and then we will have a discussion. Okay. Most extensively used dosage form in Kaumara Kritim is Kwatha. Because when you look into, Kashyapa Samhita, and when you look into Arogya Kalpadrumam, the Kwathas are explained for right from the birth and extensively for children of all ages. Concentration at dose should be low when compared to adult. Instead of making kashaya with one pala of drug, you take half pala or even small quantity, just like shana pramana and all. And preparation should be filtered as much as possible to avoid suspended particles. Comparatively sterile, can be used right from the birth. Extensive use is, you can see extensive use from 15 days of birth in Arogya Kalpadrumam. And Shita Kasha is not widely used, and Phantom is very important. Rather than Kashaya, Phantom is very important in a baby. Ideal preparation for pediatric use, particularly in infant stage, is a Phanda Kalpana. Why? When you look into Kashyapa Samhita is telling that all Kashaya should be administered in a child as Phanda Kalpana, not as a Kotha Kalpana. Why? Because Phanda is, you are only putting drug in boiling water. There is not much boiling or destructive boiling is there. So the concentration of the drug will be naturally reduced and you can easily control the dose as well. Churna Kalpana or Phanda Kalpana is otherwise known as Churna Dravam. If you want to give Ashtachurnam to baby, you make it into a Churna Dravam and you administer the drops. Likewise, you can control the dose. So Churna Dravam is not only for Kwatha, Churna Dravam, you can also convert our Churnas into Drava form, drops form, that is known as Churna Drava. So if you want to administer, Ashtachurnam to a neonate, basically, it is not possible for you to mix the Churna and administer honey. You just make it into Phanda Kalpana and you give it in drops, 1 or 2 or 3 or 4 drops to the 1 month old neonate. So likewise, Phanda Kalpana is the best preparation that we can utilize in an infant. Ideal preparation, low concentration of the medicament, which you can definitely you can control, very low residue and suspended particles. Kwatha can prepare as per Phanda Vithi for use in children. Kashyapa Samhita, Bhaishajya Kala Adhyayam is the best thing. Every Rasashastra Bhaishajya person should read that chapter. Okay, comparatively sterile, easy to prepare, can be used right from the birth, extensive use after 15 days. So I'm sorry that our time is over. You can have some quick queries. Then next you can think about it, because all the basic concepts are there. Up to what time you can administer Krida, up to at which age you should administer Krida, and what is the role of Rasaushadis, at what time you can extensively use Rasaushadis in a baby. Or whether you can administer in an infant or Kshirada or Kshira Annada or likewise. So just you think about all those things. And up to this, because almost we have completed 1 hour of presentation, definitely you must have some queries. So please ask some queries. We can have some discussions. The discussions may be much more fruitful, I think. Okay.
Sir, slide ബാക്കിയിട്ട് കണ്ടിന്യൂ ചെയ്യാം sir.
അല്ല, അത് പിന്നെ അടുത്ത സ്റ്റേജിലോട്ട് കിടക്കാം. നമുക്കൊരു ഡിസ്കഷൻ ആയിട്ട് പോകാം. ഓക്കെ.
Okay, sir.
Good afternoon, sir.
Yes, please.
Sir, myself, Dr. Kartika. Sir, I want to ask one
Okay.
question. Rasnadi Churna application over babies, like up to which month or like from first month or second month onwards, if we can apply Rasnadi Churna application over the breakdown, like that, is it contraindicated or it is indicated or any other problems will be there if we are applying?
Is Rasana Churna administration is very necessary in a baby? Do you feel that?
I'm not feeling that because I have heard 2 classes regarding that because it's
No, Kashyapa Samhita is giving very specific direction regarding administration of medicines in children. And the specific thing is that in the context of Lehana, Lehya Arthar and Lehya Anarhas. When you go for Lehya Anarhas, a baby who is very active, baby is very healthy, baby is doing his all entire activity normally. There should not be any medicine given for that baby. You only support him with the food. You should not administer. Earlier there were cases discussing regarding administering Brahmi Krida to child for improving brain function. Brahmi Krida is a Rasayana Aushadha. It is administered in a very specific condition. A baby which is acting normally, comprehending normally, talking normally, all growth and development pattern are there. There should not be something to enhance the activities, physiological activities. Brain function can be enhanced by activities, improving activities. You're learning more and more things. So that is the right way. Administering something, Induganta Kridam is a Kridam which is Balavarthana. If something is there, it is specifically mentioned for. But Brahmi Kridam not mentioned as a, Buddhi Varthaga. It is Methyam in a sense that is necessary to protect your Metha Avastha at a stage we are giving the Rasayana. But you are giving and it is a Rasayana which is Puti Praveshika Rasayana that should be administered at a later stage. Purve Vaisi Matheva. It's given a later stage. Administering that in an infant is highly contraindicated as per Kashyapa Samhita. If you read that Bhaishajya, that is very necessary. Almost all confusions will be gone. Okay, there is contraindications for all kinds of medicine administration.
Yes.
That's it. There are specific medicines explained there also. You can do this thing, you can do that thing. They have clearly explained, mentioned all those things. Thank you.
So one more thing, like if you're applying, if you're giving Gobi Chandana Gulida for babies, we are usually giving them along with that Swaratha, like Vasa Swaratha, and all we are giving.
Where? In what condition?
I have heard, like I have heard that like Gobi Chandana Gulida, one Gulida we have to give, like in one day, along with Vasa Swaratha, like not like Swaratha we are preparing, just the Vasa we are taking and Vasa leaves we are taking and then
My question is that Gobi Chandana Gulika for what purpose? For a healthy baby.
No, like not a healthy baby. Like Jara having babies will be coming.
Yeah. If the doctor feels that Gobi Chandana Gulika can be given in an infant or in a Kshirada or Kshira Annada, they are giving
Infant babies, like 1 month, 2 months.
Infancy means we can classify them into Kshirada and Kshira Annada. Kshira Annada, that's not an issue. Kshirada, you have to be very careful. In the early neonate stage, be very careful while you're administering Swaratha.
Okay.
Typically.
Okay. Okay, sir. Thank you, sir. Thank you.
And you can again use the other thing. You mix you powder the Gobi Chandana Gulika, and you can prepare it as a Churna Drava, Panda, and you can administer that drops. That would be much more simple and easy. Or otherwise, you can make a fine paste of Gobi Chandana Gulika, apply it over the nipple of the mother, and feed the baby. You should be very careful while doing that because any hot thing or any we cannot say that an unpleasant taste because at that time all times it will be there. But if something is there disturbing the baby, that breastfeeding may be affected. So that is the only concern you should be there. You have to be there. That's
Thank you, sir.
Good afternoon, sir. Myself, Dr. Shekhar. How can we fix the dose for asthma in pediatrics? And is there any contraindication?
Yeah, Asavarishta formulations, they are basically Asavarishta. When we look into Asavarishta, majority of them are Vyadhi Virida. Am I right? Ramesh sir? Majority of them we are giving it as a Vyadhi Virida Aushadas, and they are typical drugs for very specific usage. So you either you have to dilute it, as such. Even if my clinical practice, I am prescribing Asavarishta. If it is I am giving 30 ml. Diluted with equal quantity of water. So you reduce the dose, so only drop administration can be given, and again with the sufficiently diluted thing. As far as possible, the GI tract is very sensitive. So in Kshirada, as far as possible, you avoid the use. From Kshira Annada, you can have controlled use. But Annada onwards, it's fine. He can tolerate that because he's exposed to many kinds of food. That's fine with him. But in the Kshirada, because the milk is the only thing, these kinds of preparations, cotton preparations may not be even Paitiga conditions or Slashma Pitta, it's bit tough. But you can dilute it and you can administer in drop-wise if it is necessary for you. Just like, Jiraga Arishtam, you can dilute it with the equal quantity of water and you take it in a filter. 5 to 10 drops is very good for, it can act as a carminative. And again, you can go for even Dashamula Arishta. You powder it, powder Dhanendra Gudiga into it, and act equal quantity of water, filter it properly. 5 to 10 drops you can give in Kshirada, no problem. That can also act as, that can reduce so much of, gastric irritations and all. But particularly in the first 2 months, only these drop-wise administration will be better. After 2 months, you can administer via breast milk, or you can administer mix with breast milk. You can give, so that at that time, somehow the GI tract is developing, and the baby can tolerate much of the drugs which we are administering. Okay, just like these kinds of drugs. So dilution is the key for Arishtasavas.
Thank you.
And one more thing is there, Arishtasavas can be used as a drug delivery system as well. When there is a prolonged cough for baby and all, with the productive cough is there, what you can do is you can take Pipalli Asava or Vasha Arishta or Pipalli Asava, and you can mix. You can take Vasha Patra, wash it properly, crush it, and you dip it in that. So there is a hydroalcoholic extraction will happen in Arishta. Then you take it 15 ml or so. You mix it with 2 to 3 times of water. Add honey. Give it in drops. That is a very good cough syrup.
Thank you, sir. Now about the race. Thank you, sir. Thank you so much for a wonderful session.
Okay, sir. Thank you very much.
Thank you, sir. കാര്യം അമൃതയെന്ന് വിളിക്കുമ്പോ നമുക്ക് വരാതിരിക്കാൻ പറ്റില്ലല്ലോ, പ്രത്യേകിച്ച് രമേശ് സാർ വിളിക്കുമ്പോ, പ്രത്യേകിച്ച് RNB വിളിക്കുമ്പോ. എനിക്ക് പറയാനുള്ളത്, നമ്മള് ഇങ്ങനെയുള്ള കുട്ടികളോട് പറയാനുള്ളത്, you should think about, I have a similar other presentation regarding on administration of medicine in Garphinis. ഇതിന്റെ ഒരു അടുത്ത ഹാഫിനകത്ത് എല്ലാ ഫോർമുലേഷനും ഡിസ്കസ് ചെയ്യുന്നുണ്ട്, ബട്ട് we don't have time because you have to take 2 to 3 hours of ക്ലാസ്സിന് വേണ്ടി പ്രിപ്പയർ ചെയ്യുക. So naturally there are other, so നിങ്ങൾക്ക് ഇതിന്റെ ബേസിക്സ് വെച്ചുകൊണ്ട് നിങ്ങൾക്ക് ചിന്തിക്കാം ഏതൊക്കെ ഫോർമുലേഷൻസ് എപ്പോൾ കൊടുക്കണം. ഇപ്പൊ ഒരു ഐഡിയ ഒന്നുമില്ല, നെയ്യ് നമ്മൾ എവിടെ കൊടുത്താലാണ് ശരിയാവുക. നെയ്യ് കൊടുക്കുമ്പോൾ നമ്മൾ ശ്രദ്ധിക്കേണ്ടത് ലാർജ് ക്വാണ്ടിറ്റി ഓഫ് കൊടുക്കുക, അത് അൺഡൈജസ്റ്റഡ് ആയിട്ട് പോകും. അപ്പൊ അത് നമ്മൾ നോക്കുക, അല്ലെങ്കിൽ എങ്ങനെ കൊടുക്കണം, ബ്രസ്റ്റ് മിൽക്കുമായിട്ട് ചേർത്ത് കൊടുക്കണം, ബ്രസ്റ്റ് മിൽക്കിന്റെ ഇമ്പോർട്ടൻസ് നമുക്ക് മനസ്സിലായി. So there are other thing like a similar presentation is I have prepared for Garphinis. What are the precautions that we have to take? Again, the same is applicable to elderly person. So they are also again a vulnerable group. So you have to think how we can formulate medicines and what are the guidelines we have to take while we are prescribing medicines to these kinds of specialized groups. Okay, then comes persons with renal failure. Then comes persons with hepatic failure. Rasashastra, particularly mercury containing formulations, the excretion is always via kidney. So mercury containing formulations usually have toxicity when in kidney rather than liver, because the excretion probably affects during that excretion it accumulates in kidney and causing renal issues. So mercury is basically a renal issue. Okay, with medicines, of course, it is having neurological symptoms and all for prolonged exposure and all. We also need to keep it like that. Like, so it's your duty to work on these kinds of formulations and these kinds of aspects that will improve your understanding of Rasashastra by Kalpana. While you are reading that, you will realize that all these formulations, majority of the acharyas has considered all these things, and they have mentioned in they have that's why I'm talking quite often regarding Arogya Kalpadrumam. You read Arogya Kalpadrumam, you're surprised to see that all these principles have been adopted there, and it is explained in such a manner. Kera Thaila is appearing in our quite often because Kera Thaila, it is medium chain triglycerides are there, so it's a cutaneous absorption of Kera Thaila is comparatively better than the other forms of thaila, sesame oil or something like that. Two oils are equal, just Kera Thaila and our olive oil. Both are having medium chain triglycerides, and we forget about Kera Thaila and we always purchase olive oil and use it quite often. So both of them have similar properties, basically, absorption. Thank you, sir. Thank you.
Thank you, sir. Okay.